The third wave of coronavirus is once again putting the healthcare system in Bulgaria to the test. The main issue is the lack of medical personnel. The Pirogov hospital in Sofia is one of the largest in the country. It has been at the forefront of the COVID effort since day one.
Medical students have stepped up during the first and second waves of the pandemic, and they have been working in COVID wards throughout the country.
Emilia Grigorova had been working here for a year when the pandemic hit. As a 50-year student, she has yet to pick a specialty. For now, she's leaning towards burns and plastic surgery. Volunteering in a COVID department wasn't an easy decision for Emilia. She made up her mind after contracting COVID-19. Now, she prepares and administers medicine to patients.
I started working in the COVID ward in January. Now I am back here because of the third wave in March. There's a dire need of medical personnel right now. It was obvious that the people working here were exhausted. They were at their limit. That's why I'm here.
This is a challenging job because of how unpredictable the COVID-19 infection is.
It's hard to see a patient who was fine 2 days ago suddenly take a turn for the worse. Then you realize this person might not survive, or they might survive with severe complications. That is the hardest part.
Despite severe staff shortages, medical students are at an all-time high. Their number has doubled in the past 7 years to over 12,000 students in 2020. Few of them will choose to remain in Bulgaria, however, and it is not just a money issue.
There are more and more foreign students who would rather return to their home countries, probably because of the language barrier. A large part of Bulgarian students also prefer to leave the country. It is much easier to start residency training abroad, and the criteria are much clearer.
Between 500 and 1,000 doctors are leaving Bulgaria each year. New government programs were put in place to attract young doctors. In exchange for scholarships, medical students would have to work in Bulgaria for 3 years. In the meantime, university fees in medicine have skyrocketed. Some undergraduate schools cost over 5,000 euros a year.